Thank you, Mr. President. I rise today in support of SJR 15. As everyone here knows, Congress is currently discussing how to cut $880 billion from the Medicaid program over the next 10 years. The federal government suggests that states can make up the difference if these cuts go through, but our state, as we know from the budget discussion we just had, cannot handle this additional financial burden. So let's talk about what these cuts actually mean for Alaskans. 279,000 people, or about 1 of every 3 Alaskans, are enrolled in the Medicaid program. Children, seniors, veterans, pregnant women, those with disabilities, and yes, some working-age Alaskans use Medicaid to receive essential care or the essential care other programs will not cover. Over half of Alaskans' children are enrolled in the program, and 38% of all births are covered by Medicaid. 41% of those living in rural Alaska receive Medicaid coverage, and about 1 out of 10 veterans. 7 out of 9 nursing home residents in Alaska receive food, housing, and care because of Medicaid. And I'll pause here to tell a brief personal story. My grandfather fought in World War II. And towards the end of his life, my mother moved him up to Fairbanks to get long-term care. He had to have round-the-clock care. It was about $8,000 a month, which at the time was a lot of money. Now it's even more expensive. And the VA didn't cover all of that care. So to make up the gap, we had to enroll him in the Medicaid program. And there are thousands of stories just like that. These cuts will be catastrophic, not only for our most vulnerable, but for our healthcare system, economy at large, and Alaskans across the entire state. In 2023, Medicaid made up almost 4% of the state's economy. For Providence, Alaska, Medicaid comprises 25% of revenue. At Anchorage Neighborhood Health Clinic, it's 34%. At the Alaska Native Tribal Health Consortium, 40%. Many seasonal workers, like construction workers, teachers' aides, commercial fishermen, and wildland firefighters, depend on Medicaid during their off-season. Some have argued that Medicaid should go only to, quote, the most vulnerable, but simultaneously they offer no alternatives for these seasonal workers or those who are working but whose employers offer no coverage and who cannot afford very expensive private coverage. Ironically, some of these same folks are also asking for work requirements when it is exactly that working group most likely to lose their coverage if these cuts go through. I ask you to really consider what happens to core institutions like Providence, ANTHC, and our fishing and tourism industries if Medicaid is cut to the extent that we expect, when Alaskans cannot receive preventative care and hospitals are simultaneously cut off from this revenue source. So sicker, uninsured patients have nowhere to go but emergency rooms. I ask you also to consider what happens to our behavioral health clinics, which receive over 2/3 of their funding from Medicaid, when they are not able to keep their doors open. Alaska has by far the highest suicide rates in the country, and our state is already direly lacking, mental health care infrastructure. When clinics close, both patients and providers will have nowhere else to go, and some of those providers will leave, taking their children, spouses, and expertise with them. The patients may, if they are lucky, end up at a bed at API at exorbitantly high cost to the state, but many of them will have nowhere else to turn. A poll released this month indicates that the majority of the United States public, regardless of political leaning, opposes cuts to Medicaid. Every one of our districts stand to experience significant negative impact if this program is cut. This is not complicated. Cuts to Medicaid represent a strike at Alaska's economy, our health, and our well-being, particularly of our most vulnerable. I urge your support for this resolution to oppose these cuts and protect Alaska's medical care. Thank you, Mr. President.
Thank you, Senator Dunbar. Is there further discussion?